This is 7 National News, and in our top story, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and Prime Minister of the UAE and ruler of Dubai, in his capacity as the ruler of Dubai, has issued Decree number 33 of 2012, restructuring the Board of Dubai's International Humanitarian City. The decree appoints Princess Haya bint Al Hussein, the wife of Sheikh Mohammed, as chairwoman of the board. Additionally, 8 other members were appointed by the decree, which comes into effect from the date of its issuance and is to be published in the official Gazette. On the occasion of being appointed chairwoman of the DIHC, Princess Haya said that the UAE and Dubai take their moral obligation to be at the heart of humanitarian assistance. His Highness Sheikh Dr. Sultan bin Mohammed Al Kazmi, the member of the Supreme Council and ruler of Sharjah, has ordered the Sharjah Social Services Department to increase its allocation to social welfare by 45%, beginning this month, adding 50.4 million dirhams to the portfolio. The directive will take the total value of the social welfare funds to 162.4 million dirhams, which will be utilised to meet the needs of 8,092 families that have been identified by the Social Services Department on the basis of their health, social and economic circumstances. The ruler of Sharjah added that he is closely monitoring the needs of all sections of the society, especially retirees and those previously excluded from welfare support. In accordance with the Arab Health Exhibition and Congress 2012, an awards ceremony was hosted last night, endorsing the quality of healthcare professionals, companies and organisations based in the Arab region. The 5th Arab Health Achievement and Innovation Awards provided a platform to recognise the top performers in the Arab world by rewarding those that have contributed to the growth and development of the healthcare industry. The international judging panel were also commended on their dedication to the healthcare community throughout the past year, as they shortlisted the nominees for the night of the ceremony.
The purpose of the award is really to give some merits for the hospitals or individuals that they are looking to improve the healthcare service in the region. And this is the least we do, is to really give them some incentives to be better and better in the future. In the region that the healthcare is available, but what we want is really to observe from the consumer point of view or the patient side how we can make it a good journey when they come to the hospitals. And I think this is very important to understand what's the relationship and the experience that we get it when you get to the hospital.
Various categories were highlighted, including 2 new categories for 2012, the Young Surgeon of the Year Award and Cleveland Clinic Young Clinician of the Year. However, it was the Al Ain Hospital that stole the show, as they won 2 different awards from 2 different categories, the Excellence in Patient Safety Award and the Excellence in Imaging and Diagnostics Award. Dr. Mahmoud Kotb from Al Ain Hospital stated that they will continue to contribute to the improvement and development of their patients.
We are providing 24/7 services of world-class facility in interventional radiology. So our patients can have the interventional radiology services 24/7 at a world-class level. We believe in Al Ain Hospital that every patient that comes through our doors is one of us. I mean, everyone who's providing the care is thinking this patient could be my mother or could be my father. So we are taking patient safety in the heart of our business. And that's why I think we excel and we differentiate ourselves from other healthcare facilities around us.
Day 3 of the Arab Health Exhibition and Congress is going from strength to strength. The industry is witnessing more companies and initiatives focusing their efforts on empowering medical practitioners at various levels. Marquette Middle East will soon establish an academy at Dubai Tech, the world's first free zone dedicated to the life science industry. According to senior officials, they have 90 companies registered to date and are continuing to attract more. With a fast-growing population and rising lifestyle-related diseases in the country, officials say emergency situations can occur anywhere and anytime.
This academy will be training nurses and health practitioners to be able to respond to emergency cases which has to do with ambulances and hospitals and critical care cases.
In the UAE, the rate for heart disease and other diseases is rising at an alarming pace. Industry experts say it is essential for medical teams to stay up to date with the latest in technology, as every second counts in saving a life. To further highlight this point, Marquette Middle East conducted a daily presentation of a team attending to a patient who had suffered from a heart attack.
We are carrying on our board a lot of solutions for emergency medicine, for epidemiological situation like bird flus and other things. We also some solutions for myocardial infarction and some other solutions that they do happen in the hospital with more comfort, like lung failure and renal failures and other failures around the cardiovascular system in the body. So we decided to take the initiative to complement the work of our partners, but focus mostly on the other stakeholders, which they tend to be ignored in our region.
We know that in cardiogenic shock, if we lose time, if we have not a fast way to revascularization, and if we have not a good support, the mortality rate is nearly about 80%. So the loss of these patients is really often. So everything we can try and we can handle very quick and very fast in the beginning of a cardiogenic shock is a way to save lives.
And up next, we have the day's business news, so stay with us.